Hi, and welcome to Ask Dr. B. So I've been working on this series. This is the third video in a series on anxiety. And anxiety is such a big topic. And there's so many pieces of it that I've been breaking it up into chunks. First, I talked about helping us understand what anxiety is, where it comes from, that it is a normal part of human condition. It is a signal. And I talked about how people in the mental health community break down, categorize, different types of anxiety to help us better address, better study, so that ultimately we can help people be well. At least that's my goal. And in the second video, I talked about how to know when your anxiety, because we all have anxiety at different times, but how do you know when really it's interfering with your day-to-day life? And in that video, I talked about medication, not to use or not to use, but rather why it might be suggested and how to think about it. And that is the purpose of all of these videos, all of this program, this channel, is to help bring you information that can help you navigate for yourself and the people you love, to really facilitate your well-being. So today, I'm going to talk a bit more about anxiety and how to think about it. What are some common approaches to managing it? Because we all have it, but how do we manage it? And a couple of thoughts to begin with. First of all, one size doesn't fit all for anything, not too many things in life, basically, but certainly not in this space, in well-being. The goal is really to figure out what works for you or what works for you and the people you love. How can you be helpful? How can you support your friends? That's what this is all about, is helping you figure that out. Second, is that none of these things work if we don't actually practice them, if we don't actually do them, if we don't actually engage. It'd sort of be like, you go to the gym because you want to, get into physical shape, and you sit there and you watch what's going on, and you maybe, look at stuff and maybe try things out once in a while, but not on a regular basis, not with any sort of systematic approach. And you're not going to change your physical fitness. It might be actually good for your mental health. It might be calming or interesting or enjoyable, but it's not going to help you. So these things, we have to engage. We have to be proactive. It's hard when you're suffering. I know that, but we have to do our best to engage, to stay on a path. Don't give up, because even though one size doesn't fit all, lots of things work. Things help. Therapy helps. Different kinds of therapy is helpful to different people around different issues. These other non-traditional forms of self-help or other types of interventions, they're helpful too. Again, it's finding out what works for you. So stick with it, try different things, be a good advocate. Hopefully this program is helping you learn more so that you can do that. And then I want to talk specifically about, first, some of the traditional ways we think about managing anxiety. And I'm going to talk about some types of therapy just so you're familiar with them. And then I'm going to talk about some tips, things that you can try. And again, they can be in combination with some of these other things. So first, it's really important to learn about anxiety. And that's what we're doing here. I'm going to have more resources here, and there are resources attached to the other two videos. So learn about it so that you can address it, so that you can take it head on and help yourself or help people you care about. Second is, we did talk about medication. It certainly can be a part of the plan. It may not be. It may not work for you. It may not be something you're interested in or willing to do or want to do or need to do, all of that. But it's in the collection of tools in a toolkit, to use that sort of concept. You might learn about meditation, mindfulness, things that can help you remain sort of balanced in proper perspective about what matters, what doesn't. Mindfulness, I am a huge believer in meditation and mindfulness, and they are different. I'm not going to get into that right now, but we can. If somebody sends me in a question about it, I'll talk about it, or I might just talk about it down the road because I think it's really interesting. But those are different, but there's a lot of overlap in the practice of in meditation and mindfulness. But both are about really, tuning into your breathing and letting thoughts sort of pass through you. They are practices, so you have to practice them. You can work on journaling. Journaling is a great way to manage anxiety, get your thoughts down on paper so that they're not just sort of bombarding you. Art, creativity, those are great activities that can help manage anxiety. You express what you're feeling and what's sort of affecting you in a way that helps you, again, keep it in check, keep it in balance. Relaxation techniques, learning how to relax. There's progressive relaxation where you start at the top of your head and you move all the way down through your body. And it's very hard to be anxious when your body is very relaxed. And we're going to talk about that in a little bit, about some of these tips, the things you can do. Let's see. I just want to make sure I think of all the ones I talked about. Those relaxation, breathing fits in that. There are breathing techniques to slow your breathing down. Again, I'm going to touch on that a little bit more in a couple minutes. Peer support, critical, hugely important, whether it's peer groups getting together and supporting each other, whether it's group therapy, providing support to each other. And those topics are going to continue to come up in this work that I'm doing and what this channel is all about, because we all have experience, we all have wisdom. If we share it more with each other, we can all help each other be well and stay well. And then apps. Let's talk just a minute about apps. There's 40,000, I think, probably more since I last sort of looked, apps in the well-being space. And some of them are great and helpful and others probably not. So, check them out and find out, do reviews, take a look at reviews of them, find out what other people are finding helpful. I'm through this company, Weeby, that hosts this channel. We are going to be launching an app. I'm not going to share all about what it is yet. So obviously I believe in the power of technology delivering care to people. So, but be careful, and make sure that you're finding out as much as you can about something that is intended or claims to help with your well-being. Okay. Those are some of the things that are, I should also say, exercise, very important. People who exercise regularly are overall less anxious, they worry less. Physical activity is a great way to manage our worry, our anxiety, that competing activity of your body being physically engaged, active, the endorphins pulsing, all of that good stuff is really good for us physically, and it's also good for us emotionally and psychologically. And there was one other thing that made me think about. I have some notes tacked up here. Dietary. So if you consume like 10 Mountain Dews a day, not to knock Mountain Dew, but anything that has a huge Red Bull, coffee, anything that has a large amount of caffeine, your body may interpret that agitation, that jittery, that may contribute to you feeling anxious and worried because your body may get confused about what's going on. So make sure that you limit that if you tend to be sort of someone who worries. Okay. Now I just want to touch base on some of the primary therapies that you might hear about and are really indicated for dealing with anxiety. So one is cognitive behavioral therapy. What does that mean? So that means the therapist will work with you in a very structured way to help you identify thoughts that are negative or unproductive, bothersome, worrisome, destructive, negative thoughts and patterns of thinking. And there are exercises that you will go through that help you respond when those thoughts appear, help you develop strategies, and it can be very effective. It's a very, very effective tool for anxiety. So if somebody is talking to you about, would you like to try cognitive behavioral therapy, it may in fact be a good fit for you, and it is widely used. There's also exposure therapy, which is in that same camp, but a little different. So exposure therapy is all about actually exposing people in a safe environment, in a safe place, either through imaging, sort of imagining the situation that makes you anxious, or working in a virtual reality space. I know some people who do some amazing work in that space. This approach is often used for people who have experienced trauma. And so in a safe place, they will revisit the trauma gently, slowly. This should ever only be done with someone who is trained to do exposure therapy. It's really important because you can hear it puts the person back in the place, in the space, in the emotional experience that was traumatic. And so you need to have somebody who knows what they're doing so that they can titrate and ensure that the person who's going through that is getting the proper care and processing in small chunks that are tolerable. And then there's EMDR, which stands for Eye Movement Desensitization Reprocessing. EMDR. That's why we call it EMDR, because it's a lot easier to say EMDR. And what that is again, a technique that therapists who have been trained, so make sure somebody has been trained to do this. It's a way to stimulate the different parts of our brain, external means. You're not hooked up to wires. There's nothing going on like that. It's actually using different stimulations outside of you that cause bilateral stimulation of your brain, which is how we now understand our memories are stored. In fact, you all can find this out yourself if you sort of just a little insight about how this works. If you ask someone to remember something from their way, way back past, like, what was the name of your third grade teacher? The person will look up, and that looking up is your brain is retrieving it. It's like going in and pulling it out of in a drawer, a file cabinet. And so by doing this in a systematic way, it allows us to really attend to those memories that can be destructive, painful, distressing, again, in a safe environment. And as I said before, make sure that if you consider EMDR and it has good data behind it, that it can be very helpful to people, especially people who have experienced trauma, then make sure that it's somebody who has been properly trained to do this work. So I'm actually going to stop here. And then in my last video on this series, I'm going to give you some tips, other things that you can try. They're related to what we've been talking about in the first 3 in this series. But as I said in prior videos, I like to do these in chunks. So thank you to the person who sent in this great question that has allowed me to hopefully share so much information. Hopefully that information is helpful to those of you who are watching. Thank you for sending in additional questions, because I'm starting to get them in, and so I will be answering them. And thank you for your interest in taking care of yourself and the people that you love. Thanks.